Dr. Danny Avula, state vaccine coordinator, talked a lot about getting all health districts to that April 8th deadline of moving into phase 2, announced yesterday by Governor Ralph Northam. He says one thing they're doing is shifting the allocations around the state to the areas that need to get through their 1B and 1C populations to get onto phase 2, and specifically mentioned for our area, the Crater Health District is the only local one that still hasn't moved into phase 1C of the vaccination process. Meanwhile, some localities, as you mentioned, said they're going into phase 2 even earlier than April 18th, looking to next week. Avula says they have been having talks with local health districts about whether or not to require proof of residency in order to combat what's called vaccine tourism and people going to a location outside their health district in order to essentially jump the line for what they qualify under their local health districts, but didn't say if anything would be implemented at any local level. Now, switching to case rates of COVID-19, Avula says while Virginia isn't seeing the increase that is trending nationally, the rate of decrease in the state has plateaued and they are not seeing a continued downward trend.
And so we do want to move forward with this news cautiously, but I do think that as we look to the summer, and if we can see this increasing of vaccination continue and a decreasing trend of cases continue, I imagine things will continue to open up.
Now, regarding those 15 million national level doses of Johnson & Johnson that had to be scrapped, Avula says they still haven't heard what the long-term impact of the shipments for Virginia will be from that, but says next week's shipment of over 200,000 doses won't be affected. He says what likely will be the trickle-down effect of this is that when the state does go to phase 2, there won't be as many appointments available to begin with.